Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, back pain is a very common problem and will affect many of us at some point during our lives. The good news is that in most cases, it isn't a serious problem and it might just be caused by a simple strain to a muscle or ligament. As far as possible, it's best to continue with your normal everyday activities as soon as you can and to keep moving. So, to discuss on this, we have with us today Dr. SANJEEV GOSWAMI, consultant orthopedic surgeon from AGILE Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Dr. SANJEEV, for joining to Good Life, the health show. So, today we have taken the topic back pain, which is commonly seen in everybody. Now, if we want to know about the causes of back pain, doctor, what would you like to tell?
Hi, good afternoon, viewers, and thanks, Pooja, for inviting me. First of all, back pain is a very common problem in our society nowadays, and back pain affects almost all age group of persons, starting from children to old persons. All age groups can suffer from back pain, and the most important cause or the causes of back pain which we find in our day-to-day practice is as a result of many factors. Actually, it leads to back pain. The most important factor is a lack of muscle imbalance in our back, lack of exercise, and the acute lumbosacral sprain due to some bad posture, or when you try to lift something heavy from the front side, then we suddenly get a catch and we may get a back pain very often. And in older persons, the most common cause of back pain is because of the softening of the bones. They lead to small fractures in the vertebrae, and that leads to a back pain. And in younger individuals, in some situations, they develop a condition called slip disc, which we all know. The intervertebral disc, which is lying in between the two bones, they get slipped due to various reasons, and they may cause that may cause acute back pain. So these are the causes of back pain in short.
All right. Now, doctor, what is the common age group we are talking at this point in time? Is back pain seen in every age group?
Yes. Yeah, it is common in very active age groups, actually. Those who work very actively, say those who used to drive for a very long period of time, and those persons who used to ride motorcycles without maintaining a proper posture, and those persons who try to lift a very heavy object from the front side without taking proper precautions. So in that age group, the back pain is most common.
All right. Now, doctor, there must be common symptoms that people will understand that they should immediately see a doctor and should start the treatment at the earliest. So, doctor, what are the common symptoms that a person will understand that they should immediately go and see an orthopedic?
Regarding symptoms of back pain, it may vary. It may vary from an acute condition to a chronic condition. If a person suffers from back pain in acute situations, then he will have an excruciating pain on his back, and that leads to sometimes his, incapacitate him to move. He will be just like standing wherever he or she, wherever he is standing, he will be standing like a statue.
Okay.
So that is in case of acute back pain. But in chronic back pain situations, patient may suffer from a pain or a stiffness in the back. Early morning he tries to get up from bed, he will find a sort of stiffness in his back. He will not be able to move properly. And after some time, once he tries and once he gets out of his bed and gives few more steps, then the stiffness and other pains gradually subsides. So it's a chronic situation. The patient may not suffer from that severe, but a dull aching sort of pain continuously keeps on nagging his back. He is not comfortable at all. He cannot stand for a very long period of time. He will find it very difficult to walk for a distance or so. Once even after walking for say few hundred meters, he will start complaining of pain in his back, and that pain may go down, radiating down towards his backside of his leg and up to calf muscles and up to ankle joints. So these are basically two situations, two extreme situations. One is acute and another one is a chronic one.
All right, now doctor, if we talk about, there are a lot of things that one has to avoid and one has to take up in their lifestyle activities. So what are the things that has to be avoided and what are the things that they can take up in their lifestyle activities to have a ease in the back pain?
The lifestyle changes which a person has to make to avoid back pain is to maintain a proper posture while walking. His back should be, his back and pelvis should be almost 90 degrees. He should keep your back absolutely straight. And a person who is vulnerable to have a back pain, he should always avoid bending forward and lifting heavy objects from the front. He should always try to lift any object. If he at all he has to lift something, then he should sit down first, pick up the thing in his hand, then he will stand up. So this is basically what is to be done if a person is prone to having a back pain. And regarding lifestyle changes, he has to keep his body weight checked. He has to keep his back muscles and abdominal muscles absolutely strong, so that those group of muscles they can support the spine, and thereby it can prevent him from suffering from back pain.
Okay. Doctor, we have a caller at this point in time. Let's take the question from the caller and then we'll proceed with the conversation. Hello.
हेलो नमस्कार, मेरा नाम संदीप है, मैं खानापाड़ा से बोल रहा हूँ, गुवाहाटी से। हेलो
जी हाँ, सुन रहे हैं, आप अपना क्वेश्चन कीजिए।
हाँ, मेरा बैक पेन मतलब जब भी बाइक चलाता हूँ, थोड़ा सा अगर लॉन्ग ड्राइव हो जाता है तो बैक पेन बहुत सीवियर हो जाता है। ऐसे रहता है, थोड़ा थोड़ा तो रहता है, लेकिन जब ज्यादा ड्राइव करते हैं तो सीवियर रहता है। तो इसके लिए प्रिकॉशन के लिए क्या करना है? हेलो,
इस सिचुएशन को लेके पहले ना इस सिचुएशन को लेके पहले आपको पहले इन्वेस्टिगेट करके थोड़ा सा देखना चाहिए कि आपका स्पाइन में कुछ प्रॉब्लम तो नहीं है। और ये एक्सरे वगैरह प्रिलिमिनरी हम लोग एक्सरेज एडवाइस करते हैं। सो आपको एक एक्सरे करा के उसमें देखना चाहिए कि अगर कुछ उसमें एबनॉर्मेलिटीज़ है या कुछ प्रॉब्लम्स है तो सॉर्ट आउट करने के लिए। एंड बाकी जो आप जैसे बताया, आप ज़्यादातर बाइक चलाते हैं, तो बाइक चलाने के समय आपका बैक जो है बिल्कुल स्ट्रेट रखना ज़रूरी है। पूरा सीधा रख के आप बाइक चलाइए, और हो सके तो एक आपका बेल्ट मिलता है फार्मेसी में, लंबोसैक्रल बेल्ट बोलता है उसको, वो बेल्ट लगा के आप चलाइए, तब आपको राहत मिलेगा।
All right. Thank you so much for calling at this point in time. I'm sure the question you have asked and doctor gave you answer will be benefited for you. Now, doctor, coming back to the question which I have asked you regarding the things which one should do and one should not do. Now, let's talk about the treatment procedure. If at all a person is having a back pain and comes to you, so what is the first thing? Of course, there will be X-rays, MRI and CT scan as well. So what is the first procedure of diagnosis? What would you like to tell on the treatment part?
Regarding the treatment of back pain, it depends actually at what condition the patient comes to you. If a patient with an acute back pain comes to you, then the first and foremost thing is before doing investigation, you should try to relieve the pain of that particular patient. And for relieving pain, we need to have a proper bed rest first. We ask the patient to take proper bed rest before asking for any investigation, and we prescribe some medications along with that, anti-inflammatory, anti-steroidal drugs. Then we give some muscle relaxants. Then we give some medicines to improve the blood supply to the group of muscles on his or her back. Ask him to take a bed rest so that he gets some relief from the pain.
Okay.
And once the patient gets relief from the pain, and then only we further go for the investigation, because in acute situations you hardly get any finding in the investigation reports. So once the pain subsides and patient can start move a little bit this way, that way, then the basic and the first and foremost investigation which is advised is an X-ray of the lumbosacral spine.
Okay, Doctor, we'll come to the conversation, but right now we have another caller waiting for us. So let's take the question. Hello? Hello? हाँ.
हेलो हाँ सर, मेरा एक सवाल है जैसे कभी कभी रात को अचानक देर से सोने के बाद हम उठते हैं तो ऐसा होता है कि जैसे लगता है कि शरीर काफी दर्द होता है, पीछे काफी दर्द होता है और वो दर्द ठीक होने में 2-3 दिन समय लग जाता है, तो इसका रीजन क्या है?
Can you repeat the question for me?
क्या आप अपना क्वेश्चन फिर से करेंगे? हेलो?
हाँ, क्या सुन पा रहे हैं मुझे?
जी हाँ, हम सुन पा रहे हैं. आप अपना क्वेश्चन फिर से दोहराइए.
मेरा एक सवाल है कि कभी कभी ऐसा होता है, हमेशा नहीं, रात में कभी देर हो जाती है सोने की, तो सोने के बाद जब हम उठते हैं तो ऐसा लगता है जैसे काफी दर्द होता है, कंधे में पीठ में इस तरह दर्द होता है और दर्द कम से कम 2-3 दिन तक ऐसा रहता है, तो उसका क्या कोई कारण है जो हम न करें और जो दर्द ना हो? कई बार ऐसा हो जाता है, महीना में 2-3 बार ऐसा हो ही जाता है.
Sorry, I couldn't understand you.
All right. We'll try and connect to the caller, Doctor, once again. But we were talking on the treatment part, Doctor. You were mentioning about the test which you prescribe to the patient who comes with a back pain to you. So do you suggest them for an MRI or an X-ray? What do you want to tell?
No, initially, first and foremost, investigation is an X-ray. If you find any abnormality in the X-ray or the patient happens to suffer from a radiating pain down towards his leg and it is not being subsiding for the last 2 or 3 weeks despite giving all proper treatment, then you advise the patient to go for an MRI scan, because in MRI scan you could find out those structures which are not visible in X-rays actually.
Okay.
And MRI could show you the position of the discs. MRI could show you the position of the nerve roots which are traveling through the small tunnels in the bones, and it will actually definitely show you the amount of damage to the nerve roots or the compression to the nerve roots or the extent of the slip disc. Disc is how much big, whether it is a small bulge or it's a small protrusion or it's an extruded disc. So there are different terminologies used for medical terminologies. Those are the situations in which the slip disc is described.
Okay.
And an extruded disc is an extreme situation where a patient might need a surgery later on.
All right, Doctor, we'll have more conversation, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on back pain. Now, Doctor, coming back to you again, we were talking about the treatment procedure and what kind of suggestions do you give to the person who have come with a back pain. Now, Doctor, after the reason is ruled out of the back pain, do all the patients need surgery? And if yes, so what is the procedure, Doctor?
More than 90% of the patients who suffer from back pain, they do recover with treatment like bed rest, with medications and little bit of exercise. And only less than 10% of the patients who suffer from acute back pain and they are not relieved by any sort of medication or physiotherapy or rest, they only require surgeries. And surgeries mostly in acute backache condition where the cause is mostly a slip disc. In that situation, a simple discectomy surgery will suffice. A discectomy surgery, it helps in relieving the compression which is putting over the nerve roots, and a discectomy is sometimes we may have to reinforce those discectomy with the help of putting some screws in the vertebral column so that the spine remains healthy and patient gets relief from the pain thereby.
All right. Now, doctor, after the surgery is conducted, there are a lot of precautions that the patient has to take, and you also prescribe to the attendant. Now, what are the precautions should be taken after the surgery, doctor? What would you like to tell?
With the recent advances in spine surgeries nowadays,
okay,
the spinal discectomy surgery has become it's become very safe nowadays, and the procedure is also very short, and we have got machines like laparoscopic machine which are very small in diameter, and the harm to the patient and to the back and to his spine is very minimal. So we can mobilize the patient very early after a spinal surgery nowadays, especially after discectomy surgeries, and we could mobilize the patient from the second or third day of surgery.
Okay.
And the precautions, in the form of precautions, he has to take a rest for a few days so that his wounds and other ailments, they help in reducing the pain. And till the pain subsides, he has to take a little bit of rest. And once the wound heals and all stitches are removed, he can resume his normal daily activities. However, he is advised to undergo a course of exercise or a physiotherapy for a few more months so that he doesn't suffer from back pain later on.
All right. All right, doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello, namaste.
Hello.
हेलो हेलो
जी हाँ, हम सुन रहे हैं, आप अपना क्वेश्चन कीजिए।
सर, ऐसा है, मेरा एक प्रॉब्लम है। रात में कभी सोने के बाद जब हम उठते हैं तो ऐसा लगता है जैसे पीठ में अचानक दर्द हो गया, कंधे में दर्द हो गया। हमें अपने से लगता है कि क्या भारी खाना खा लेने के बाद ऐसा होता है या कोई और वजह है इस तरह का। महीना में 1-2 बार इस तरह हो जाता है।
आपका जो प्रॉब्लम जो आप बता रहे हैं ना, जो भारी आपका जो महीने में 1-2 बार वो फील करते हैं पेन, वो बेसिकली हमको लगता है कि आपका जो काम का शेड्यूल है, जो वर्क शेड्यूल है, वो थोड़ा ज़्यादा है। आपका मसल्स जो है जितना वेट कैरी करना चाहिए उतना कैरी अभी नहीं कर सकता है, और बेसिकली ये मसल्स का फैटिग है। वो फैटिग होने के वजह से मसल्स का पेन होता है, कंधे में होता है या पीठ में होता है, कभी ऊपर होगा कभी नीचे होगा। सो मेरे ख्याल में आपको थोड़ा मसल का एक्सरसाइज वगैरह और बैक मसल स्ट्रेंथनिंग एक्सरसाइज करने से ये प्रॉब्लम से आपको छुटकारा मिलेगा। ये ज़्यादा मतलब सीरियस प्रॉब्लम हमको नहीं लग रहा है। फिर भी आप एक बार किसी को दिखा के एक बार इन्वेस्टिगेशन करा लीजिएगा, हो सके मेरे ख्याल में आपको जल्दी उसमें राहत मिल जाएगा।
All right. Thank you so much for calling at this point in time. Now, doctor, if we talk about the role of body weight, does it play an important role in the back pain issue as well?
Yes. Obviously, body weight plays a very important role in back pain. An obese individual who is having hardly any muscles in his back or in his abdomen, an obese individual who is having hardly any active muscles in his back and his abdomen is more prone to suffer from back pain. Similarly, we see in pregnancy situation, and a pregnant lady is also more prone to develop back pain, as because the spine gets into a different position and because of that the patient suffers from back pain.
Okay.
And that is why the body weight is more important to keeping a healthy body weight, and especially the amount of fat in your body. That should be a bare minimum. Otherwise, your muscles, they become inactive. They cannot support your back. They cannot support your spine properly, and thereby it leads to back pain very often.
Okay. Now, doctor, how important is to include exercise in your lifestyle regime every day to have a normal and a proper life?
The role of exercise in back pain is tremendous.
Okay.
Is tremendous because more than 90% of the patient, more than 90% of the back pain cases, they recover or they remain healthy throughout life with the help of exercise. Because permanently you cannot do surgeries in each and every patient, neither they need any surgeries, but still they complain of back pain. So it is all because of the imbalance or the weaknesses in his back or his abdominal muscles. So it is very, very important to keep the back and the abdominal muscles strong, so that those group of muscles can protect or support your spine, and thereby it will help in reducing the back pain. So the exercise should always be included in a routine manner in each and every individual, especially the strengthening of his back and abdominal. That is a core group of muscles. We call it core exercises. So the core group of muscles has to be very strong enough so that they could support the spine, so that thereby the patient helps in, he gets relief from back pain.
All right. Now, doctor, there must be certain tips and tricks to avoid back pain. So what are those tips and tricks you would like to tell our viewers who are watching our show?
Exactly. The tips and tricks to avoid back pain in a situation for all of us to know that we should always maintain a proper posture wherever you are, whatever you are doing. Whenever you are standing, whatever you are sitting, you are doing something, you are driving, or whatever it is, you should maintain a proper posture. You should keep your back always straight and upright. When you travel for a long distance, if you travel in an uncomfortable situation or uncomfortable position, once you try to get out of the car, you will have back pain. So maintaining a proper posture while working in the office, while working with a computer, while working in your kitchen, while standing or waiting for someone, so maintaining a proper erect posture is very, very important. And that is a very important tip. That is a very important advice to my viewers, that you should always try to maintain a proper posture. And it is especially seen in children, no? In children, when they study, nowadays most of the children, they study in beds. I have seen they study in beds. So while if you study on a bed, then your back tends to bend forward a little bit, and then you study. So that is actually a very bad posture for anybody, and that is why nowadays children are also coming to us with a lot of back pain. So I always make it a point, I always advise the parents that ask them to sit on a table and a chair. Ask them to study on a table and a chair, so that his or her back remains straight. If your back remains absolutely straight, then you can always prevent back pain. And those exercises, regular, very, very simple exercise, only leg extension exercise, we call it a leg extension exercise. Lie down on your abdomen, then try to extend the leg one by one on your back. Hold it for 5-10 seconds, bring it back one by one. Once you do the right side, then you bring it back to your bed, then you do it on the other side. If you keep on doing this exercise at least for 5 minutes in a day, you can easily avoid yourself from suffering from a back pain.
Okay. Now, doctor, lastly, what would you like to tell on the dietary part? Now, diet is also very important to take up in your lifestyle regime. So, a proper nutrition, a proper supplement is also important to include in your lifestyle regime. So, on dietary part, what would you like to tell?
On dietary part, as such, the diet doesn't have a direct relationship with back pain.
Okay.
Any diet, whichever is being followed in our system, is accepted. But the thing is, diet has to be monitored only for one part, to keep your body weight under control. You cannot allow your body to swell or body to accumulate lots and lots of fat in your abdomen or in your back.
Okay.
Because if you do not follow a proper diet plan, what will happen? If you do not follow a proper diet plan, you have a sedentary lifestyle, you do not exercise, you do not go for any outdoor activities. Nowadays, playing and other things are become very rare thing. So if you do not do these things, and at the same time you are taking all the foods which are having lots of calories in it,
All right.
then what will happen? Your body will start increasing day by day, and increased body weight will always, as I have already told, increased body weight will always prone to having a back pain.
Okay. Thank you so much, doctor, for those tips and tricks to avoid back pain. And it was wonderful speaking to you at this point in time. Well, thank you so much for this. And well, viewers, with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.